Solano here. We're here with Teresa today. Thank you, Teresa, for letting us do your video. We're going to be doing a few syringes of Radiesse. Now, Teresa has done Radiesse in the past and did very well. So as we've marked out here, we did a little cleanse on the skin. We're going to focus on the nasolabial folds. We'll do a little in the cheek. She had a concern that the filler might create a little more creases through her. I told her that would not happen. And we're going to do a bit in the temple. And if we get too picky, we notice, well, there's a little bit more hollowing on this side than that side, but we never see ourselves with it. Other people see us. So Teresa is a very confident woman, and she's got a great self-image, and so we're just doing a little refresh here. And so I'm going to do a little bit more of a cleanse on the skin, and then I'm going to do the numbing medicine. It's the 1% lidocaine with 1 to 100,000 epinephrine. We are in Tampa, Florida, and in the Villages, Florida. I'm going to have you rest your head all the way back for me, please. And so we've done our hurricane preparation and planning, and we will be closing the office for Friday. And so we'll be rescheduling some of those appointments. We'll be here for some hours on Thursday. And of course, we'll still be answering the phone. I will be answering my phone if patients have specific questions. So now I'm going to use the numbing medicine. So I like to use this little buzzer. Thank you all for tuning in. This is my 1% lidocaine with 1 to 100,000 epinephrine. Hello, Linda. Thanks for joining in. Now you'll feel buzz, and then you'll feel pinch here, Teresa. 1, 2, 3, pinch. You feel big pinch, little pinch. Not too bad there?
Not too bad. 1, 2,
3, pinch. Just a little more tender in that area. We'll go slowly. She's been using her ice. Teresa is going to go back into work later today. Pinch as soon as she's done here. Pinch. And I'm never in a hurry. Most patients, they feel a little bit of the pinching with the numbing. They say it's not too bad. It's the rare patient that I'll give them relaxing medicine for the filler. Sometimes I will use relaxing medicine. The buzzer distracts. The buzzer distracts. There's only so much the brain can pay attention to at one time. So if you use the buzzer, then Charlene, can you just hold the pressure? Okay, and keep your glove on. Yeah. Thank you very much. Hold a little pressure there. I'm going to do a little numbing on this side. Very good. Everything's looking good. And I'm going to numb a little bit on this side here. Buzz and then pinch. 1, 2, 3, pinch. All right, a little tender there. 1, 2, 3, pinch. I like to use the cannula. 1, 2, 3, pinch for most of my injections. Sorry, that's a little bit tender. Give her a little break.
Is this
Try
Botox?
to make it easy. And this is not Botox. That's right. Everything does look good. And Botox weakens the muscles so you don't form the creases. This is filler, so it's going to plump. You feel pinch. 1, 2, 3, pinch. Okay. Very good. Thanks for tuning in. Thank you for the hearts and the shares. And thank you so much to Teresa for allowing us to share. You can zoom in on that. That's fine. Thank you very much.
Zoom in on all.
Yep, all of them. Yep. Perfect. We're going to zoom in so you can see. Thank you very much for your kind words. Now what I do is I take this 27 gauge half-inch needle. Yeah, tilt that one up a little bit there. So this is the 27 gauge half-inch needle. They have not given evacuation notices or anything like that. Now, Teresa, do you feel a little bit of a pinch here? Little pinch?
How long does the filler last?
Radiesse can last about a year. Some people say 1.5 years. Some people say 9 months. So it depends on the person. It depends on a lot of different things. But it is a very popular filler. It is a temporary filler based out of calcium. So you actually would see it on X-ray. But it's a very small amount. Now this is the filler that actually has, it's a blunt tip, and it's got a blunt tip cannula there, so you can see that there. Some people feel their filler only lasts months, and it depends on what type of filler and where you have it done. Sometimes you need to see your before and after pictures before you can tell if a filler did what you wanted it to do, because we see ourselves and we forget what we used to look like. That's very common. Until you see the picture. You feel a little bit of a pinch here, Teresa?
Barely.
Pressure pinch. So I'm using some of the Radiesse now, and as you noticed, I used that little twist technique to get the cannula as atraumatically placed as possible, and then I use the shiver technique. I like to just put very fine amounts of the filler over the course of that nasolabial fold. Back and forth, back and forth. So I'm putting about 3/10 of a cc here. I do mix my filler. Can you look at the questions, please? Charlene, you need to come over. I do like to mix my filler with some lidocaine. It makes it a little bit more dilute. It reduces the viscosity. You can already see how it fills in the crease there in the nasolabial fold. Everything's looking good. Thank you very much for the comments.
You want me to read everything?
Yeah, read out questions. Yeah, if they've got a question or if they... And thank you for keeping your comments nice. We block people occasionally if they just... Some people, you know, there's always people always try and say something silly. It's the world. But we get a lot of very positive questions, and we get a lot of thank yous from people who say, I didn't realize that's how it could be done. Not everyone will choose to do these treatments, but if you are choosing to do these treatments, my job is to make sure you know your options. Teresa, how are you feeling, dear?
Oh, great.
Everything's looking good. Hello, Adrian. Thanks for joining in. So we're filling in, we call this the melolabial fold. Some people call it the marionette line.
Can you inject my junk?
No. We need to see you first, so... People are doing fillers in different body parts. They're doing in arms, legs, the buttocks, and fillers, although you need a lot of filler.
What's the price on the syringe?
So if you want to know pricing, you can go to our website, imagelift.com/pricing. And there's pricing there depending on what you choose. So it's imagelift.com/pricing. And it's on our site. Go to the web page, you'll see the button there, and you can see all the different pricing for some of the services that we offer. Also, a consultation really is the best way to get a price because it depends on what you're looking for. Everything's looking good. Okay.
They said, I don't think it's a serious question.
You're coming through here. So then I'm doing the same thing on this side here for the smile lines.
Says she looks a little scared.
Do you feel scared?
Oh, not at all.
She's very relaxed. She's, she's dressed for work, going into work later.
Oh, I'm fine.
There you go.
I have great confidence in this doctor.
Oh, well, thank you very much. Hello. And there's another Teresa who's just joined in and is watching now.
Do you change the needle often?
For the cannula, with one patient, you don't need to change the needle. The cannula is blunt to begin with. So one cannula is usually enough. Sometimes the cannula can get blocked, and then you do need to change a cannula, but it just depends on the person. But you can see these lines are already softening very nicely. I'm going to turn your head a little bit this way. Everything's looking good. Thank you for tuning in. So fillers are the future of plastic surgery. There's no downtime. The results look very natural, not overdone when you have the right artist. Results are immediate. And we have short-term, we have long-term fillers available. Thank you for keeping your comments nice. Appreciate that. Everything's looking good. Yeah, the weather's still good here in Tampa as well. It's not too bad. But we're still watching that forecast, the broadcast on the forecast. Okay, so now that I've done some filling through these areas here, I'm going to do a little bit in the cheek, and I'm going to go nice and slow. We're not in a hurry. It's always better to come back another day and do more rather than go too far. And that's my job, to make sure we don't go too far. The most important decision you make is who is taking care of you. And so we hold
They're
our patients.
asking how much she's paying for the filler.
Right, so go to our website. You can see pricing there. It depends on the person. We do have our specials with Radiesse, so check that out. You can give us a call, 813-463-9245. So now we're doing a little bit in the cheek, and so I did the twist technique for the doctors and students that are watching, learning about technique. The shiver technique is very effective.
Someone has a coupon. A coupon, I guess, for here. What's the purpose of the Botox injection?
Botox weakens the muscle so that you don't create the creases when you frown or raise your eyebrows up really high. And it also can change the position of your brow by elevating your brow, weakening the muscle that pulls your brow down a little bit. You feel a little bit of a pinch there?
Just a tiny one.
Everything's looking good. Perfect. So even just with the small amount, now we tend to get the little dark circle under the eye. Now we're filling that area in. So we filled a little bit more here than over here. Okay. Hello, Bill. Thanks for joining in. Thank you for your comments and shares. Please make sure you follow us on Facebook. We're on Image Lift on Facebook, YouTube. We're on all of the social media platforms. So I find that little insertion point where I did the numbing. You feel a little bit of a pinch there?
Hardly felt a thing.
So then I twist to thread the cannula as gently as possible. The cannula tip is right in this area, right here in the nasojugal groove, right at the infraorbital rim, and then I just injecting a small amount here, a little 1/10 of a cc here, 1/10 of a cc there, and it's more diluted, which makes it easier to get an even distribution.
Can you go to work after this?
Yes, you can, and Teresa is going to go to work after this. Yes, she can, and yes, she is. Very good. So as you can see, there's no downtime. Now, usually from something like this, usually you're not going to bruise, but you can. And if you get a bruise can be around 4 to 7 days. It usually, of course, it always fades. You can usually cover with makeup. Everybody's different. And then you can insert the colorful story of your choice as to why you might have a little bruise on your cheek. And so I've got just a little bit left of the filler. And as I told Teresa, I was going to show her. Charlie, can you mix those together for me, please? So can you see how it softens through these areas? Now it doesn't accentuate the creasing, but it softened the creases through here. With what I've got left, I'm going to do a little bit in the temples and maybe just a tiny, tiny bit. Now as I tell people, you don't want to taste the chocolate cake before it's done baking. So we'll do a little bit of massage. There is a bit of swelling. Can you see how it fills those areas in, Teresa?
Yes, yes.
Okay. So what I'm going to do is I'm going to do the last little bit with the rest of the filler. All right. Hello, Dr. Sadik. Thanks for joining in. So we're doing a little bit of Radiesse to the nasolabial folds and to the smile lines in the cheeks. I'm going to have you rest your head all the way back for me. I'm going to turn your head to the side. We're going to do a little bit in the temple. She's got a little more hollow on this side than on the other side. Thank you for tuning in. The corners of the mouth, it can help. Someone said they do like to eat their chocolate cake before it's done baking. Well, I can identify with that, but when it comes to cosmetic treatments, better to give it a little bit of time. So just putting a very small amount here. The twist technique, twist, twist, twist. And then I'm just subcutaneous in the temple here.
She's
Teresa,
going to look perfect for the storm.
There you go. That's right. I know. This is how we prepare for Irma here.
Right.
The bottled water's all gone, so now they're coming for fillers. And I inject and then I mold it as I'm injecting. I like to make sure that what I inject, you want to flatten it as much as possible because it gives an even distribution of the product. I will put a little bit more on this side than what I put on the other side because she just had a little bit of a depth there. Now, we always have one side that's different than the other. Everyone has facial asymmetry before. I'm going to turn your head this way just a little bit. And I tell people you're going to have facial asymmetry afterwards. See a tiny, tiny bruise here, but we'll do our best to...
Is it good for acne scars?
Yes, the fillers, Radiesse not so much, but Belafil is FDA approved for use in acne scarring, and that's a popular acne scarring treatment.
Dr. Rich, how long was your training?
So I did 5 years of college, 4 years of medical school, 1 year of general surgery internship, that's 10 years so far, and then I did 4 additional years of head and neck surgery training, and I did 1 year of fellowship. So 15 years of training. I've been practicing for 13 years. Yeah, that's a lot of my life, but I hope to live a lot longer. And so, not that it's most of my life. Let me turn your head this way just a little bit more. I'm going to build just a little bit more here in the cheek. And then we're done. Thank you for tuning in. So the twist technique helps us to get into position as atraumatically as possible. Now that I've done a little bit of the filler there, she probably feels even less. I'm going to have you close your eye. Use my smart finger here to feel where the edge of that cannula is.
Looks great.
Everything's looking good. Small amounts, shiver technique. And the shiver technique is good for even distribution of the product. Or if you're an injector and you have a tremor, you just tell the patient you're using the shiver technique, and that explains your tremor. And okay. After fillers, if you feel a firm area, you just need to massage things down. Hello, Laura. Thank you for tuning in.
This was awesome.
I do have some 5-fluorouracil that I can sometimes inject to break up collagen if there's a firm formation or nodule that you feel. But massage and time usually takes care of it. Okay, perfect. So, open your eyes for me. Make a big smile, big smile, big smile.
And they're
so your
asking
smile
about
looks
me.
natural. Very good. Now relax as best you can.
Is that Botox?
Botox weakens the muscle. This is Radiesse, so we did a little through here. There's a little bit of swelling from the injection that we did. We did a tiny bit in the temples. But how does it look overall, Teresa?
Oh, I think it looks great.
Make
Big
a big
difference.
smile,
Yeah,
big
big
smile,
difference.
big smile. It looks natural. She's not overdone. So we keep it that simple. And just to show her, and then put the mirror down for just one moment,
Sure.
and then you can see. So here's where we filled in some of the creases. We filled in a little bit in the cheek. There's a little bit of shadowing there, but you can see the depth of the creases before and how deep those areas can be. And so thank you very much for tuning in, and thank you for your comments. And so these are the before, and now she looks natural. Make a big, big smile, Teresa. So thank you very much, Teresa,
Thank
for
you.
sharing, and we're going to zoom out. Thank you for your comments and questions, and we will have more coming soon. But these are helping people look younger. If you want to look more attractive, we just have to, it's always the smile. So thank you, and we'll see you soon. More videos coming soon.